Okay, good afternoon, everyone, and thank you for your patience. We were dealing with some technical problems that we believe we have resolved. Welcome to the Friday afternoon, January 1st, 2022 electronic visit verification public meeting. On today's agenda, we're going to go out over some general EVV outreach and communications, home healthcare services reminders, and implementation for home healthcare services for electronic visit verification, general PCS reminders for electronic visit verification, as well as personal care services system updates for electronic visit verification, data updates for personal care services, and EVV compliance, EVV personal care services manual edit compliance, and we'll go over our EVV contacts as a reminder. Okay.
All right, thanks, Janice. I'll cover the EVV outreach and communications piece here. So we wanted to provide a quick update on some of the outreach and communications that we are doing in the future. We are making some updates to the DHS EVV website. Those are currently underway. We've heard from a number of you that we needed to make some changes, that there is some difficulty in locating information on the website. We also wanted to make sure that there was a clear delineation between personal care services information and home health care services information. So you will see an update related to that in the new layout of the EVV website. We're also going to make sure that the new items and information that go onto the website are going to be noted with a yellow new designation. So when you go onto the website, you'll be able to immediately identify the information that has been updated on the website. So look for those changes to come out in the next 2 weeks. We will definitely be issuing a listserv communication once those are made, and you can go out and check them out for yourself. So for general EVV program issues or requests to be added to the EVV listserv, we just wanted to remind you that you should contact the EVV resource account at ra-pwevvnotice@pa.gov. That way that you'll get all of those communications that are going out. Future communications related to EVV for home healthcare services will also be released via the EVV listserv and posted to the DHS EVV website. So it's really important that you are added to that listserv in order to get those notifications. We also wanted to let you know that new alternate EVV specifications will be made available for all EVV programs in mid-February. Vendors will need to review the new technical specifications for all EVV programs. That's for personal care services and home health care services. Sandata is also going to be conducting some alternate EVV town hall meetings, and those are scheduled for March 25th and May 20th. Let me repeat that. They're scheduled for March 25th and May 20th. And that's for any providers that are using alternate EVV. Training for new users of the free DHS Sandata EVV system will begin in late April. This is mainly for home healthcare service providers, those fee-for-service providers. The enrollment announcements will be made in late March. And we'll also be going through some of this in an upcoming public meeting that will be hosted in mid-March. And if you use an alternate EVV vendor, you do not need to attend that training. So again, the training that we're talking about here is for new users of the DHS Sandata EVV system. Upcoming EVV public meetings for this year, we have one scheduled for March 18th. That's from 1 to 2. We'll have another one June 24th from 1 to 2. Then in September 23rd from 1 to 2, and December 9th from 1 to 2. The registration links will be made available on the DHS EVV website, and we'll also be sending those out in an upcoming DHS EVV listserv message. So you don't have to worry. These will be posted All these dates, as well as the registration information, will be posted to the DHS EVV website, and we will also make sure that they're shared out via the listserv. We also wanted to make sure that you are aware that the rollout of the 5G mobile communication technology, it should not impact EVV systems. With the rollout of 5G, mobile phone carriers announced that there's a phase out of 3G cellular networks and services, which will occur throughout this year. Each one of the mobile phone carriers has a different date for when that 3G phase out is set to occur, but it is supposed to occur this year. The phase out of 3G does have potential impacts at the device level though. So older phones and devices will no longer work on the mobile network. They will not be able to make or receive calls or texts or use data service. But please note that once the 3G network is shut down, as long as the device is connected to Wi-Fi, any apps should still be able to function. So we just wanted to make sure that anyone using a 3G only generation phone, that you should reach out to your mobile phone carrier for additional information related to this. But again, it should not impact EVV systems. With that, I'll turn it over to Ellie.
Thank you, Britt. Now we're going to talk about home health care services and the EVV implementation. The 21st Century Cures Act mandated that states implement EVV for home health care services by January 1st, 2023. The department intends to similarly provide a soft launch period targeted to start in spring of 2022, where home health care services EVV error status codes will be set in a pay and list disposition prior to January 1st, 2023. For claims that contain home health care services during this time, MMIS will perform validation against the EVV aggregator to determine if the information submitted on the claim matches the EVV PCS visit data stored in the EVV aggregator. However, EVV error status codes will set without impacting claim payment. During this period, the claim will continue to successfully pass DHS EVV validation and process through the normal chain claims adjudication process. The department issued a provider notification letter in July of last year, identifying the required services and next steps to begin the implementation process. The department published the list of Medicaid state plan and waiver services identified as home health care services that are subject to EVV. This list is available on the DHS EVV webpage. Home health care services requirements MA bulletin is anticipated to be issued by April. Home health care services providers need to determine whether to use the DHS EVV solution or their own alternate EVV system. Technical specifications for home health care services alternate EVV providers will be available in the future and will be posted to the DHS EVV website once available. The list of alternate EVV vendors currently used for PCS and may also be able to support home health care services is available at the following website. Home health care services providers who also provide PCS should start working with their vendors to prepare to integrate for the home health implementation. To keep current on the EVV home health care services implementation, please refer to the Pennsylvania DHS EVV website at the following website link. Home health care services providers are strongly encouraged to request to be added to the EVV listserv by sending an email to rapwevv@pa.gov, making sure to include the provider name and email address.
Okay, thank you, Ellie. And now I will go over some general EVV PCS reminders, as well as EVV PCS system updates. Next slide. The SAN data release schedule has been made available on the DHS EVV webpage, and you can find that under the EVV implementation updates header. Next slide. Some system reminders. Providers that are using the DHS EVV system should remind their direct care workers to update the SAN Data Mobile Connect or SMC application following a SAN Data mobile application release to make sure they're as current as possible. Staff should be communicating with their administrators on issues with SMC and/or telephonic visit verification or TVV. And administrators should reach out to the Provider Assistance Center only when they can't find a resolution to the SMC password resets. So only if you can't self-manage your password reset should you reach out to the Provider Assistance Center. We highly suggest that all agencies using the DHS EVV system have at least 2 administrators for EVV in the potential event that one of their primary administrators is unavailable and need to use your backup. Okay, next slide. As a reminder, our ODP fee-for-service providers should reach out to their supports coordinators or service coordinators to ensure program diagnosis code is stored in HCSIS for that individual or participant. This enables the DHS EVV system to automatically receive client updates. HCSIS authorization files absolutely need the diagnosis code to upload into the DHS EVV system, or you might get some errors. The program diagnosis code is now a required field for newly created ISPs in HCSIS for ODP as well as OLTL. And this update ensures HCSIS authorization data will be loaded timely into our DHS EVV aggregator. Okay, some general EVV PCS updates. Fee-for-service service descriptions have been updated, and the adult autism waiver services have been added to the updated version. The spreadsheet will be available on the DHS EVV website. T1019 systems notice has been shared with the managed care organizations. We anticipate that a MA bulletin will be issued and public notice published by April announcing any updates. Any encounters posting ESC 927 or ESC 928 are now setting in a denial disposition for community health choices for dates of service on or after January 1st, 2022, so beginning the 1st of this month. And systems notice SYS 2021-012 CHC ESC disposition update was issued previously related to this. Okay. Now it looks like we're going to hear from Paul from SAN Data.
Thank you, Janice. I appreciate it. So a lot of the things that I'm going to be talking about are things that you may have heard before in the past when we've talked about PCS, but bear repeating because this is also going to be affecting how home health services affect you as well too. So next slide, please. So we're going to talk about the addendums. Currently, all the addendums are housed on the Pennsylvania website, and we've been encouraging you to, make sure that you check the website for all the up-to-date technical specifications as well as addendums, and that's going to be the same for home health. As you may recall, Britt mentioned in one of the earlier slides that there's going to be new technical specifications that are sent out for home health. The goal is to consolidate. We know that this is a lot of documentation, a lot of information. We're trying to consolidate all of the specifications into 2 or 3 different documentation so that you and your vendor know exactly where to go and what is expected of you. We don't expect any major changes to how you're sending us the visit data, but we're trying to make this easier for all of you as agencies as well as your vendors to make sure that you're getting the data to us in the correct method that it needs to be. So once we send out that message to everyone that the technical specifications are ready, we will also talk about those on those town halls that were mentioned in the previous slides as well too. So make sure you're always checking the website, and you will see that a lot of these technical specs are changing coming up here in February. Next slide, please. So let's talk again about some of the reasons why your visits may get rejected. There's several reasons, and the most popular 8 really are listed here on this slide here. The first one, client not found. There's multiple reasons why a client may not be found. The client wasn't sent, the authorization wasn't sent to the promise system. The promise system then, of course, cannot send it to SANDATA. So we need to have that tracking inside of each of those systems to be able to send it to SANDATA. So the client's not found. Visit dates out of range. And this happens very infrequently, and essentially is going to happen maybe to a newer agency that gets a new account. If you started your account, let's say, and I'll just use January 1st of 2021 last year, you started on January 1st, 2021, and that's the effective date of your account, and you tried to send visits for December of 2020, that would mean that your visits are out of range because those visits were for December 2020 and your account was started on January 1st. So visit date out of range. Worker not found usually happens because you're sending the worker file and it's not finished being sent before you send your your worker file is not finished or completed being sent to us before you send your visit general file. So again, the worker file doesn't complete, and then you start sending your visits, and of course, then we can't find the worker in the visit information. Schedules past due, again, if you're trying to update or you're trying to send in information about a schedule past the due date, then again, it'll reject your visit. The row is not found. Again, you're trying to update a row or delete a record that truly doesn't exist. Hours exceed maximum allowed, and visits sent in for more than 24 hours. And technically we star that in asterisk because we've allowed it to be 25 hours. However, most visits should only be 24 hours. However, we do accept 25. And why do we do that? Because you're going to have caregivers that clock in a little bit early, caregivers that may clock out a little bit late. So of course we want to allow a little leeway here for those people that, again, you're not going to be able to get people that'll clock in right at 1 p.m. and then 24 hours later clock right out at 1 p.m. So we give you a little leverage there, some leg room. The visit date is empty, and then of course the version number is duplicated or older than the current one. So again, these are common errors that may reject the visit from getting into the system. This is not even talking about claims yet. So this is just the actual visit record itself. So moving on to the next slide, thank you. So if you do have any issues with your visits getting getting rejected, please reach out to us. You can use the customer care portal, and that's at, of course, sandatazendesk.com. I encourage anybody that has not signed up for the customer portal, please sign up for the portal. It is a system that you can just go in, you can type your tickets into it, and you don't have to monitor all these emails back and forth. So it's a much easier, much cleaner way for you to monitor your tickets all in one place without having to look at different emails. The aggregator portal, again, remember the aggregator portal is for all those users that are not going through the MCOs. That this is usually most of the people that use the aggregator portal are using fee-for-service visits. And again, remember that STX number up top needs to stay blank. Learning management system for training. If you have any questions about the aggregator and you want to take some re-education, please take a look at the sandatalearn.com website and take the aggregator training. We always recommend that. And also remember, there's always the online manual in the aggregator. For any question you have, there's that online manual in there as well too. And then of course, there's a DHS website, the alternate EVV provider testing guide. If you have any questions about testing and you're new to home health, this is for home health, or you're new to PCS and you have not tested yet and you want to get some information about testing, there's a 2-page quick reference guide to how to test on the DHS website at this point right now. And that will be getting updated as well too, because of home health as well moving forward. Next slide, please. Thank you. So little claims. This is obviously where the money hits the road for everybody. This is the big question everyone wants to know is why do my claims get denied, or either a 927 or a 928. So again, the biggest thing is the data elements. And what we say that is when you get the 928, the name obviously says, visit not found. And that really could mean a lot of different things. It could be that there is a provider Medicaid ID error. So the provider Medicaid ID that you have, sent to the aggregator may be correct, but somehow you may have manually, missed the number on the claim, and there's an error there. It doesn't happen too often, but it does happen. So again, make sure that those two things match. The client Medicaid ID number, big one that we see happen, where the Medicaid ID number gets inverted sometimes as well too. So you may see it in the aggregator, but it may not be correct on the claim. So again, make sure you're validating that. The payer and the service and modifiers, this is actually probably the most common one, where the payer is actually incorrect. And it happens quite frequently, especially with S9122, because a lot of different payers use S9122. Sometimes the payer is listed wrong on the claim or wrong on the visit, and that obviously will affect whether or not you get paid. The date range based on the visit start dates, and then again, the total visit times or the units found may not map up correctly for the claim validation. So again, the biggest thing and the biggest takeaway from the top bullet point is check your data, make sure the data matches. So when you get that 928, you look at it and make sure that all those data points match up before you submit any request to the program offices for any help. Because once you validate that the data is correct, then we can move on to the next pieces for you. Again, other reasons why they may fail are, duplicate batch IDs, that are sent. There's no matching visit found. So visits weren't found for, a variety of reasons. There's a lot of different reasons, but most of them are the top bullet points of the data set. And then unmatched units, and that of course is the 927. Next slide, please. Thank you. All right, so agencies receive no matching EVV PCS visit found, again, for a variety of reasons. And this is kind of a reiteration of what I mentioned on the last slide. No matching EVV visit found doesn't, again, always mean your visit is data is not in the aggregator. So again, make sure you're checking the aggregator and checking all those data points. Use the aggregator to your benefit. Data differences between the claim and the visit, again, are the #1 reason for no matching visits for PCS, and we expect this to happen obviously for home health. So it's really good practice right now to use PCS as you move into home health care, if you're also an HHCS provider, to start looking at those types of data points, so that you're making sure that when home health care kicks off, you're not going to have any issues with denials when for home health care as well too. Again, for a visit to be eligible for validation, it must be either a verified or a processed status. So if you see it in there and it's not processed or verified, then you won't be able to submit a claim towards it. The payer, provider, client service, and date of service began all need to match the claim. Again, this goes back to the data points. It's all about data matching data. So again, I know you're all handling a lot of different data points. So, again, just, it benefits you to take just an extra couple of seconds to make sure everything matches up, so that you're not having to chase things on the back end. So claims validation, just looks for the exact matches for all those criteria, excluding units. Again, so if your units don't match, that we're not looking for on the claim, of course, that's a different part of it, but we'll still find the data based off of those data points. So again, the claim validation looks for exact matches for all the criteria that we were speaking about in the previous bullet points and previous slides. Units then are matched based off of the matching rule, depending on the payer program as well as the services. And then agencies date span billing, may be inaccurate. So please make sure you reach out to your respective program office so you can discuss again how you should be billing the date span billing. Next slide, please. Thank you. So other reasons, again, a lot of this is somewhat redundant, but again, duplicate records, there's no record. This one is also a common one, is claim is sent before the visit info is received. And sometimes this happens actually, unintended. It just, or it's people are rushing to get the claim out the door. But again, make sure that you've got your visit in the aggregator before you submit that claim, because that will also cause a denial for you. Multiple caregiver services are not overlapping, and then we've seen this happen more frequently than late. Remember, you have to have that overlapping time period. You've got to have 2 people present for that multiple caregiver service. So if you have a 2-to-1 caregiver service, and 2 people are supposed to be there for, during an 8-hour period of time, that time needs to overlap, or you're not going to be able to get credit for that. And the last one is sometimes we see this happen, which is a bill visit is set to false, which means in that record that your vendor sends to us, that JSON file, there's a bill visit field in there. If it's set to false, that means you'll see it in the aggregator, but it means that claim validation will actually overlook that. It'll say no record. So again, we're really encouraging you to review your visit information for its accuracy, to your claims, before you submit those claims, because again, just an ounce of prevention is worth a pound of cure in this case. We'd rather have you taking a couple extra minutes and make sure they're correct, so you don't have to chase those dollars that you're waiting for on the back end. So again, just some troubleshooting aids. If you remember, on the PADHS website, there are some ESC documentations. You can see that link down there at the bottom or in the middle of the slide there. Again, highly recommend you have that document. Document also tells you some things to use for troubleshooting purposes. Please, 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 take a copy of that, download it on your local PC for your reference, so you don't have to always go out onto the website, but it is a very handy, helpful document for your troubleshooting aid. And again, also, please review all documents with your program offices or MCO representatives before opening a support ticket with SANDATA, because usually it could come down to a simple billing issue that you can correct quickly, instead of having to submit a ticket with either SANDATA, HHA Exchange, or NetSmart, depending on whoever is working with the MCO. Thank you. And lastly, provider resources to help you out. Of course, we've got multiple provider resources. As I mentioned before, the customer care portal, highly recommend logging into that and using that moving forward. And you'll notice in parentheses there, SANDATA on demand. We're going to be using, we're going to be calling it, either the portal or SANDATA on demand, because we're also going to start adding videos as well as documentation, the technical specifications for ALT-EVV. A lot of that will be contained on SANDATA on demand. So you may be hearing SANDATA on demand a little bit more frequently as well too, moving forward. We also, on SANDATA on demand for the EVV library, you'll see those those videos in the library. It's like a little bit of a YouTube type of library. There's probably 30 different videos, more for the DHS SANDATA EVV users and not the aggregator / ALT-EVV users. But again, there's a bunch of different videos in there. If you just want to know about how to set up a user, there's a small video in there for users. How do I do visit capture? What about SMC? So there are all these little small videos, so you don't have to go through the whole entire training if you want to know just about one small piece or portion of how to do something within the DHS SANDATA EVV system. And again, you can always still go to the SANDATA Learn, and that's how you'll get your welcome kit if you're looking for new credentials as well too for administrators. And then lastly, always go to the DHS website for your main primary resource for any information that you need. And I think we're moving over to, is it Chuck? I'm not sure. It was.
Oh, nope, it's Janice.
Nope, it's back to Janice. Sorry, Janice. There you go.
That's okay, Paul. Thank you for that great information. And we're going to share some data updates from our electronic visit verification and personal care services. Next slide. So during calendar year 2021, the Pennsylvania DHS EVV system had an average system availability uptime of 99.9%. During 8 months of the calendar year, we observed 100% DHS EVV system uptime outside of scheduled maintenance. On December 7th, the nationwide Amazon Web Services, or AWS, incidents impacts on the DHS EVV system were reported to the DHS EVV provider users, and those agencies were advised to have direct care workers utilize telephonic visit verification, or TVV, for clocking in and clocking out of the point of care during the outage. Sandata took swift action after the outage to leverage its network and firewall systems to ensure seamless and uninterrupted coverage in the event of a similar outage in the future. Furthermore, similar measures were taken to remediate similar single points of failure within the AWS ecosystem. Okay, next slide. So during the reporting period of October 26th through January 17th, Promise found matching EVV visit records for over 88% of OLTL fee-for-service personal care services service details processed. 5.32% of OLTL personal care services service details denied due to units bill being greater than the number of verified units in the DHS aggregator at the time of claims processing. And then 6.24% of OLTL fee-for-service personal care services service details denied due to not finding a matching EVV visit in the DHS aggregator at the time of claims processing. So for calendar year 2021 at a glance, OLTL has seen a fairly steady improvement with EVV compliance for calendar year 2021 as providers were integrated and became more comfortable with the EVV system. Our cumulative EVV ESC 925 percentage for calendar year 2021 was 80.55% for fee for service. So that's a great thing, and we're going to look to keep that momentum going. And now we're going to hear from Chuck on ODP's data. Hopefully we didn't lose Chuck. Are you there, Chuck? Okay, so we seem to be having some technical difficulties with Chuck. So I'm going to cover this slide for him. So since October 26th, Promise found matching EVV visit records for 91.5% of ODP PCS service details processed. 4.45% of ODP personal care services service details set ESC 927, indicating the units billed are greater than the units verified in the DHS EVV aggregator. And 4% of ODP personal care services service details set ESC 928, meaning no matching EVV verified visit was found at the time of claims processing. And in calendar year 2021, ODP has observed steady improvement from month to month on the count and percentage of personal care services service details finding matching visits in the DHS EVV aggregator. Although we observed a recent increase in the percentage of service details denied for insufficient units, we anticipate in 2022 that ODP providers will continue to find matching EVV visits at the time of claims processing. And now we're going to hear from China for some OMAP updates.
Good afternoon. So OMAP processed 1,116 PCS service details that were subjected to EVV. Over 78% of service details processed in PROMIS found matching EVV visit records during the claim processing. Nearly 11% of OMAP fee-for-service details denied for insufficient units. That would have been the 927 units in a verified status in the DHS aggregator at the time of the claims processing. And an additional 11% service details denied for 928, denied for lacking a matching EVV visit in a verified status at the time of claims processing. Next slide, please. Fee-for-services calendar year 2021 at a glance. OMAP fee-for-service observed improvement in the percentage of PCS services details finding matching visits during processing over time, particularly between July and December of 2021, which fee-for-service anticipates will continue throughout the calendar year of 2022. Next slide.
Okay, we're going to talk about DHS aggregator account cleanup. And DHS is continuing to assess multiple unused accounts, and will be communicating a decommissioning strategy. By decommissioning unused accounts, reporting in the DHS EVV aggregator and the DHS EVV provider portals are going to be easier for providers. So we're looking to have all that cleaned up so we can have clean data, make everybody happy. Next slide.
Thanks, Janice. So now we'll just give some updates on the personal care services manual edit compliance. This is something that we definitely have heard from a number of you about, and we wanted to give an update on this. So DHS is assessing EVV manual edit compliance for fee-for-service at this time. This is relevant to personal care services only at this time. As a reminder, providers are expected to achieve at least 50% of their EVV records for verified visits without manual edits. And just a reminder that manual edits are any EVV visits missing information, or the EVV visit information was entered incorrectly and requires any type of edit or correction. It's also if a provider has to manipulate data or add missing data or change the data in any way after the service is delivered. So that any of those situations is deemed a manual edit and would apply to the manual edit compliance rate. So DHS is assessing the manual edit compliance rates by the program and payer. So ODP, OLTL, and OMAP are separately assessing the manual edit compliance rates. The department is performing targeted outreach to provide technical assistance to providers that have either not submitted EVV data or have a high percentage of manual visits. Providers should self-monitor their EVV compliance at this time and should work to improve their areas of non-compliance. DHS is not currently pursuing any monetary sanctions for EVV compliance. And we are working to develop a user-friendly compliance report in the DHS EVV aggregator portal and the EVV provider portal for those providers to efficiently determine their quarterly compliance percentage. So look for that in the near future. And I'll turn it over to Chuck.
All right, for ODP, well, if you're one of the 525 providers that does personal care services, you should have received a letter. So as of breaking down those 525, we have 69% of ODP personal care agencies were found in compliance with meeting ODP's expectation of having fewer than 50% of EVV visits manually edited or entered. And then we have, you see 58 there, 11% were moderately out of compliance. And then we have 103 providers that were, 20% that are severely out of compliance. So one of the things here is that on the letters, if you've received a letter, if you're severely out of compliance, there's a question pro link that you must complete. So if you're one of 103, you need to complete the question pro link, and you have 10 days to complete that questionnaire. So far, as of this morning, we've received 30 out of those 103. So anyhow, if you have any questions, please contact the ODP mailbox. Thanks. And Janet or China?
OMAP fee-for-service submitted manual edit threshold compliance letters to 20 agencies on January 20th and the 21st. 50% of OMAP fee-for-service PCS agencies were found compliant with meeting OMAP's expectations of having fewer than 25% of EVV visits manually edited or entered. 30% were close to meeting OMAP's expectations, with 50% to 75% of visits being free of manually editing or entry. And the remaining 20% were determined not to be meeting OMAP's expectations, with manual edits exceeding the maximum thresholds. OMAP fee-for-service providers with concerns regarding technical issues issuing the DHS EVV system, using the DHS EVV system should be referred to our Provider Assistance Center at 800-248-2152. OMAP providers with questions regarding their performance percentages or responses should be directed to RA-PWFFS_EVV@pa.gov. We are asking our providers that are not in compliance to please respond with a response within 14 days. Thank you. Next.
Okay, thank you, China. And next up is OLTL. OLTL has been working on pulling provider compliance reports and getting ready to send out letters, and we're looking to get them out in upcoming weeks. The letters and the process will look similar to what was described by ODP and OMAP fee-for-service. And OLTL will be available to provide technical assistance to providers who have high manual edit thresholds, so we can have a back and forth communication and work to improve those providers who have a high manual edit threshold, which is lowering their compliance rates, and we'll continue to monitor those providers and work with them in the future to get those improved compliance rates. Okay, EVV contacts. For any technical issues, for example, a DHS and data account assistance need, a welcome kit issuance, an account unlock issue, or DHS SANDATA EVV other issues, please contact the Provider Assistance Center. And their email is papac1@gainwelltechnologies.com, or you can call them at 1-800-248-2152. For providers who have issues related to alternate EVV and need account unlocks or access to the DHS aggregator portal, any integration status inquiries or issues with the DHS aggregator accepting file submissions, they should contact the PA Alt EVV support team. And the email address for that is paaltevv@sandata.com, or they're available by telephone at 855-705-2407. So for providers who are having issues related to HHA Exchange or CHC billing, you should contact HHA Exchange, and their email address is support@hhaexchange.com, or you can contact the affiliated CHC MCO. And then vendors who need to integrate with the CHC MCO HHA Exchange, they should contact paintegration@hhaexchange.com. For any providers who have issues related to physical health, managed care organization claims and billing, they should contact the appropriate physical health managed care organization. So just to remind everyone, if there are any general EVV program issues or requests to be added to our EVV listserv that comes from the department, you can contact the EVV resource account at ra-pwevvnotice@pa.gov. And providers with technical issues reaching out to the PAC or SANDATA Alt EVV team can copy DHS on emails to those resources at the following email address: ra-pwevvissues@pa.gov. Then providers with support ticket numbers that they wish to escalate with DHS should reach out to DHS at ra-pwevvissues@pa.gov. And just a quick reminder to copy our resource account on any tickets and issues, include ticket numbers and background information so that all parties can track it a little easier. And then for EVV claims resolution contacts, for any billing issues such as why are EVV ESC setting, what does EVV ESC settings mean, questions about what you're finding in the aggregator, you can contact the program offices. So for ODP, you would contact our claims resolution section. And the phone number for that is 1-866-386-8880. or their RA account at ra-odpclaims.res@pa.gov. They're available Monday through Friday, 8:30 to noon, and then 1:30 to 3:30 p.m. I'm sorry, 1 o'clock to 3:30 p.m. For people needing to contact the OLTL program office, you can call the OLTL provider call center. That number is 1-800-932-0939. You want to choose option 2 to get to provider operations. And that line is operated Monday through Thursday, 9 a.m. to noon, and then 1 o'clock p.m. to 4 o'clock p.m. If you have any OMAP issues, you want to contact the OMAP provider inquiry line. That phone number is 1-800-537-8862. You want to choose option 2 and then option 6. Oh, and then option 1. And those hours of operation are Monday through Friday, 8 o'clock a.m. to noon, and then 12:30 to 4:30 p.m. So that brings us to the end of our presentation. We appreciate you giving us your time and attention today. And I think we're going to stay online for any questions you can think of that you want to submit to us in the chat. And we'll see if we can update any FAQs that they would pertain to. So we'll mute ourselves, but we'll stay on the line for just a little bit longer for any questions. Thank you very much for participating with us this afternoon, and we hope you have a great weekend.